Nurse Barb joins us right now, and you are looking pretty in pink and blue, and there's a reason.
There sure is. A lot of my patients are starting to ask me about what to do if they're thinking about getting pregnant.
All right. So, is it true that in 2020 that we had the lowest pregnancy rates?
It's true. The birth rates had been declining for a long time, but then when the COVID pandemic happened, a lot of women were like, oh, no way. Too much uncertainty. I can't deal with anything right now, let alone think about becoming a mom.
Yeah. I almost felt though that there were a lot of people who did have babies though in 2020.
Yeah, there were quite a few that were started before the pandemic or just got started when we were trying to connect with our partner and we were
Yeah.
using a lot of that
Yeah.
time together.
Yeah.
But they did decline.
Yeah. They definitely did. Okay. So, what should women do to prepare if they are trying to get pregnant?
Well, the first thing to do is stop using birth control, right? And you'd be surprised at how many women go, "Oh yeah, I've got to stop that." But when you're stopping birth control, what I'd like you to do is start taking a prenatal vitamin with folic acid in it, because we know that if you do that for at least 3 months, it reduces the risk of some serious birth defects in babies. Now, those serious side effects or birth defects are really, really rare, but let's reduce them even further. And think about making what we call a preconception visit with your healthcare provider.
Okay. And then, should you be testing for anything?
Yeah, when women come in, I take a full history. I talk a lot about their family history, if there's any issues that have come up, and their own medical history. And a couple things that I test for is I want to make sure my patients are immune to two very serious infections. One is chickenpox, and two is German measles. And so I typically get some blood work. I look to see if they're at risk for diabetes or thyroid disorders, which are common in women. So do make that appointment if you're thinking about it.
Yeah. And are there some new things or some other things that women who are trying to get pregnant that they should plan for right now that they may not even know about?
Yeah, one thing that's very surprising to women is that we can do blood tests to see if people are carrying any of those inherited disorders. You've probably heard about sickle cell anemia and
Oh,
cystic fibrosis. Well, with those, a parent can carry the defective gene that causes that. They don't have any symptoms, they don't have the disease themselves. But if their partner also has a copy of that defective gene, and they get together, well, most of the time, 75% of the time, there's no problem. But 1 in 4 or 25% of the time, they can both pass on the defective gene and they can have an affected child. So now, Malou, we can check for over 290 different of these recessive or silent disorders.
wow. Oh my gosh, that's wonderful. That is great to know. And then, so what about nutrition for women trying to get pregnant?
Well, this is the best time. When you're motivated to become a mom, that's the best time to try to be at your healthiest. We call it getting your nest ready, right? So the best thing to do is to ask yourself, am I eating healthy? Am I getting enough calcium, either from calcium-rich food or taking a supplement? Am I exercising at least 20 to maybe 40 minutes a day? And am I getting plenty of fruits and vegetables, because those are loaded with macronutrients? I'm all about food first, and it's really important to try to get to a better weight. If you've got a little bit of weight to lose, think about losing it before you get pregnant, because that reduces the risk of high blood pressure and diabetes that can happen during a pregnancy.
Yeah. Okay. So I know you know a lot, Nurse Barb, because you're a nurse practitioner, right? Right. And you also
I
wrote a book.
am.
Did you write a book?
I did. I wrote a book called Nurse Barb's Personal Guide to Pregnancy, and I take care of pregnant women here in Silicon Valley. And so I've been doing this for a long time. And I would say, do the prep work ahead of time before you get pregnant.
Yeah. Always great to hear from you, Nurse Barb. Thank you so much.
Oh, thanks so much, Malou. Take care.
You too.